Willie Rennie.
To ask the Scottish Government, in light of the reported concerns regarding the Nike conference in Edinburgh, how the contact tracing process that has been piloted will balance patient confidentiality and the need to alert people of public health threats.
Cabinet Secretary Jean Freeman.
Contact tracing involves a person who has the disease identifying people they have been in close contact with while they may have been infectious. Outbreaks are investigated by means of a risk assessment, which takes into account patient confidentiality, public health needs and individual consent issues. To protect patient confidentiality, only close contacts are informed that they may have been exposed, so that they can be given relevant health information and, in the case of COVID-19, know how to self-isolate in order to interrupt chains of transmission. Index cases are always asked for permission to disclose their personal details. The use of information about patients is subject to data protection legislation, and all personal health information is held under strict legal and ethical obligations of confidentiality. In the circumstance such as this pandemic, these are difficult balancing discussions between the importance of patient confidentiality and the importance of information to the public. As we move to the scaled-up use of test, trace, isolate and support in the next phase of our response, we are giving active consideration on how that balance should be struck.
Willie Rennie.
The issue has moved on again today. In addition to the Lloyd staff, the Kilt shop and the digital agency, we now know that the Nike delegates were taken on a walking tour of the Old Town by tour guides. None of them were contact traced by the incident management team. This is about the confidence in the contact tracing system. The First Minister said yesterday the process was rigorous. If that was the case, why were they not contacted?
Cabinet Secretary.
I believe, as the First Minister said, that the process that was undertaken at the outset here and subsequently in subsequent contact tracing, as we have done elsewhere, probably most recently and most notably for members, is in and around the Home Farm care home in Skye, is rigorous. It is governed, it is a clinically led process governed by Health Protection Scotland that uses risk and specific infection science. So those other instances that the member has quoted will have been instances that the contact tracers were not aware of from their conversation with that index case that led to the tracing of 8 other individuals in Scotland, 25 from memory globally that involved other countries and other health protection teams in elsewhere. So I do believe the process is rigorous. I think it is the right process. However, there is a really difficult balance that has to be struck between individual patient confidentiality, which is really important. It's an important ethical part of how our clinicians and our health service work, that people have confidence that their information is held confidentially unless in circumstances where they agree that it should be released. Patient confidentiality is really important, but so too is public health and the need for the public to understand the situation that they're facing. And that is why I've said that I absolutely understand the concern. And as we look to move into the next phase of our response to this pandemic, we are giving careful consideration as to what that balance ought to be, and taking the views not only from members, as I've heard them expressed, and from others, but also from Health Protection Scotland and our clinical teams, including our Caldecott Guardians and others, about what would be the best balance that we can strike in any given circumstance.
Willie Rennie.
The tracing process is an important part of keeping us safe as we ease the lockdown, so the public do need to have confidence in this process. If we are treating the public like adults, should the incident team just not have put this out in the public domain? If that had been done, anyone at the hotel or in contact with any of the Nike delegates would have been able to take precautions. I want to protect patient confidentiality, but alerting people about an event or a building does not breach that. In hindsight, should this incident have been made public? Looking forward, is there ever a circumstance where an outbreak would be put into the media?
Cabinet Secretary.
So I thank the member for his follow-up question, and I would say that all of us have the benefit of hindsight. But at the time, with the information we had, we took what I believe was the right decision at that point. But I do recognise the competing calls on protecting patient confidentiality, on letting the public know, particularly in the case of this particular virus or any other virus that causes such widespread harm and is a pandemic. And that is why I've said that we are giving that situation, that balance that needs to be struck of judgment, very careful consideration as we move into test, trace, isolate and support on the scale that we will need to do that. Because I also agree with the member that the public's confidence in that process, the confidence that they have, which is twofold. It is the confidence of the individual to reveal all the information that we need them to reveal, confident that we will hold that securely, alongside the wider public's confidence in the whole exercise and strategy, that they can be confident that that will be capable of spotting and hunting down the virus and suppressing it where those outbreaks occur. So this is not straightforward, but what I am saying is I recognise the concerns and we are giving active consideration as we move forward into the next phase of our dealing with the pandemic, whether there are better ways that that balance can